Welcome to our introduction of NTT's 2021 Global Threat Intelligence Report, the GTIR.
Today, we're going to be looking at insights for the healthcare industry.
I am Sushila Nair, VP Security Services at our Chief Digital and Strategy Office here at NTT Data. This is the 9th year we've published the report, and as always, with lots of information for you, which will really allow you to understand the cyber threat landscape. Jon, do you want to talk about how we put the report together?
Thank you, Sushila. I'd be happy to. I'm Jon Heimerl, Senior Manager in the Global Threat Intelligence Center.
Let's turn for a moment to healthcare. When we have a look at healthcare, we see that the top attack type, no surprise there, web applications. So definitely that growth of healthcare using applications, perhaps for portal, for patient communication. Any thoughts there about looking at that information on key factors that we might want to share with healthcare? And I know, again, their cybersecurity assessment score showed that healthcare felt they were not at the level of maturity that they wanted to be at either.
Yeah, for the CA score for healthcare, cybersecurity advisory score, no organization, pretty much no geographic area really felt they were had a truly mature security program within healthcare. MIA, Middle East Africa, came the closest at 1.56. They had the highest, but that's still, again, if you're for healthcare, if you're not, again, in that 3 area or higher, you're really not that good business practice. So every area, more than anything for healthcare, for the CA's results showed that pretty much every healthcare organization needs to continue to improve their overall security infrastructure. And one of the big findings issues for healthcare, as you mentioned, Sushila, was web application attacks and application-specific attacks combined. I mean, globally, those two attack types were 62% or 67% of all attacks, right? In healthcare, those two attack types were 97% of all attacks.
Oh.
So that tells us that attackers focused in healthcare are really zeroing in on the online presence, the web presence of organizations, the websites, the customer portals, the telehealth solutions, the applications and tools that the attackers can get to from the outside on the internet. And that's what they're focusing on.
Wow, that is so interesting. And really, I think we have to move past that idea that pen testing your application before you release it, that is not sufficient security. We really need to be embedding security all through that process. And I love the fact, Jon, one of your key recommendations there was security by design. So really needing to look at security by design, application security testing, absolutely critical, that you're using really good tools and have the capability to close those holes in your applications.
Thank you for joining us today as we explored insights for the healthcare industry from the 2021 NTT Global Threat Intelligence Report.